My name is Brittany Johnson, and I was a Dwight Tillery Fellow through the University of Cincinnati's Master of Public Health program. I really enjoyed it. I learned a lot. I got to participate in a number of different projects, so I got to see a wide breadth of community health, particularly community health for underserved African Americans. I learned that there are lots of people who are in need of the services provided by the Health Expo, particularly for health screening. I learned that people are interested in getting not only health screenings but also other information related to lifestyle changes. I think there is maybe a misperception that some people don't care about being healthy, and I learned that there are people for whom that is a priority even in the midst of all the other struggles they may have. Well, when I read about Dwight Tillery in the biography, I was impressed, and I thought his story was inspirational, and what he had done for the city was inspirational. Since I'm not from Cincinnati, I was really unfamiliar with its history along really racial lines and also economic lines. Seeing some of the disparities out here, I was unfamiliar with that. So reading about how he had made that a interest of his and a commitment of his, I thought that that was wonderful. Yes, I think that what I learned in the classroom was really great and really wonderful, but I think that it's a completely different learning experience when you get to see it firsthand, and when you're not just reading about it, you're living it and you're actively doing it. So I think that I learned the wider scope of what goes on in public health programming. It's so much more than just sitting at your desk and planning things out. It's interacting with people, it's learning the needs and desires of people, it's learning the limitations of people, and I really think that that helped to supplement what I did learn in the classroom, because I don't think that there would have been any textbook that could have told me, you know, this group of people has this unique set of needs and so on. I would say that if you're interested in community health, if you want to learn about the public health needs of disenfranchised people, if you want to see how health is an integral part of life, just in relation to social, economic, and political needs, all of that is related to health. So I would say that if you care about people, particularly if you care about people in the Cincinnati area who are historically disenfranchised, that you would learn a lot from this fellowship. I also think you will learn a lot from this fellowship if you want to know about reaching people who are in challenging circumstances. Well, one thing that I appreciate, which was somewhat of a surprise to me, was the level of involvement that I was able to partake in. I guess I expected, because I was a newcomer to this field of work and also to this organization, I expected to be given a more hands-off, or I guess I expected simpler projects or to just input data, nothing too major, but I was surprised and pleased by the extent to which I was able to actively participate, even to make some decisions. I was able to fulfill some decision-making roles and really do tasks that were central to the success of the project. So I wasn't just kind of like in the background, I was actively participating, and that was one of the most pleasant outcomes of it, because I really got to learn a lot more that way. I got to do the work as if I was actually part of the projects.